start off by telling my own virtual visit story. It was about 3 years ago. We were on a road trip. We were visiting Yosemite. It was a California coastal road trip. We had a friend visiting from Denmark, and he was not feeling well. And since we were on a road trip and in a car with someone who did not have American health insurance, my first thought was, well, let's bring him into a retail clinic because at least if he needs a prescription, it will be available right away. And we all had our smartphones with me. I had an iPhone. In fact, this picture was taken with my iPhone. This is the bridge near Big Sur. And I looked up to see where the closest potential retail clinic was, and there wasn't one nearby. And so then, and you heard Holly mention prior to joining NextGen, I worked at United Healthcare, and on my United Healthcare app, I could also look for other access to care. And so I looked for a community clinic that we could perhaps drop in. And we did find one in the town we were visiting, so we drove to the clinic, walked in, and asked if our friend could be seen. And they said no, that you had to have an appointment to be seen in this clinic. And so my third option was, I remembered because of my application that I had access to virtual visits via an online service, and decided, well, this is really our only option, so why don't we try this? I haven't used it before. And so we used Doc on Demand, which was something that I, as a United Healthcare benefit member, would have access to. And in the parking lot of the clinic, we dialed into this telehealth visit with a clinician. We found out the price of the session immediately. My friend is Danish, so he wasn't quite comfortable with having an interaction in English without me being there. So I was there, my husband was there who speaks Danish. So all three of us were in the car in this parking lot participating in this telehealth visit. He answered the intake questions, and then the provider came online and went through the session and decided to prescribe a medication. And through e-prescribing said, where would you like me to send this medication? And because we were traveling, we were on the road, we actually gave the city we were driving to. And sure enough, a couple hours later when we arrived there was the prescription. So I give that example because, for one, it's a real live example, but also it really showcases what the market drivers are for patient engagement in telehealth. And the first one is the importance of patient acquisition and retention due to intensified competition. So this was somebody new to the country who didn't have a relationship, and getting access to care was our main priority. The intensified competition was, I looked for retail clinics, virtual visit companies, something to provide access to my friend. In this case, patient as a payer, my friend was a payer. He was going to pay out of pocket. But in the U.S., I'm on a high deductible plan, and many other patients are moving to high deductible plans. So patients are becoming payers. The digital health and tech utilization is just growing and exploding. And you see the stat here, 77% of Americans own a smartphone. All three of us had our smartphones with us. The pressure to manage chronic condition and focus on wellness, that is a switch and in focus from a telehealth standpoint, and we'll talk about that a little bit more. But as value-based care becomes more popular, and even patients as payer who want improved outcomes, this focus on chronic conditions and wellness are becoming more and more important. And if you see, the reason is because 86% of the healthcare spend is in this area. So it's the old 80, 20, 90, 10 rule, where the focus of the cost is where you're going to get focus from organizations and the government, CMS. And then we talked about the shift to value-based care, focusing on outcomes and populations. Telehealth and patient engagement becomes crucial for that because you want to engage the patients in that population appropriately and when they need, when it's a chronic condition or if there's a way to improve their wellness that may not be specifically to a chronic condition. This was the examples of intensified competition. So when we started looking at telehealth as an organization, and I joined NextGen about a year ago, I was seeing all these summer headlines from retail clinics moving into the virtual world. So exactly as I said, I was looking for one. Now imagine in that case where we couldn't find one and they had a virtual visit capability, we would have been able to use it in the car parking lot as well. So Rite Aid has been talking about bringing in virtual visits, Walgreens, CVS, and Anthem insurers are starting to allow access to their membership. So it's just showing that this is just growing and very real at this time in the market. And this drives home the future of virtual visits. I don't know if you're familiar with Dr. Eric Topol. He's actually out of San Diego, and he's a thought leader. And one of his quotes is, "Tomorrow's office visit will increasingly take place everywhere but the office." So there's been some criticism about telehealth. Maybe it's not taking off as quickly as it should, but this is showing that he is estimating that it's going to surpass the physical visit and grow to about 1.1 billion visits. The focus, just because of some of the market dynamics, patient engagement dynamics, is going to be on chronic condition management. What a great way to engage your patients in a way that's convenient for them. Wellness and prevention, follow-up visits, reviewing labs and images, medication management. These are all potential use cases that are outside of that urgent care model that I described with my friend. These are some specific telehealth statistics. So it probably isn't surprising that 74% of patients in the U.S. would use telehealth. That there's a high satisfaction level. 94% are very satisfied with telehealth. Patients are prioritizing access to care, just an example I gave, and healthcare executives are focused. The cost-effective part of this slide, the top one is an example from a hospital where they estimated that they would say, and this was the University of Pittsburgh Medical Center, $86 every time a patient would use an online service instead of visiting the ER or urgent care. And that is important if you're in a value-based contract or if you're managing a population. The 43 opportunity cost is from the patient perspective, where it was posted in the Harvard Gazette, estimated that the average time it takes to access care from the home to the care and back is almost 2 hours, 121 minutes. And the opportunity cost associated with that is because you're only seeing or having actual care in that time window for 20 minutes is this $43. So they're putting a value on the patient's time in this example. So what do we mean by telehealth? Well, I gave an example of one of the definitions. So telehealth description for real-time video visits comes in 3 flavors. The first is the virtual visit example, which is the established patient and condition. So I know my patient, I'm having a virtual visit with that patient with real-time video. And there may be there is scheduling associated with that, maybe copay payment. They're in a waiting room, and then there's documentation of that visit. It's a formal visit with real-time video. The second is the urgent care model, which is what my friend had, and that is it may be a new condition and a new patient in his case, or it could be a new patient, actually an existing patient with a new condition. That is more of that urgent care model for real-time video. And then the third is the provider-to-provider, which is I may bring in a provider, a specialist, into this real-time video visit with my patient. Maybe it's a behavioral specialist. Maybe it's an orthopedic surgeon or a dermatologist if I want them to participate in that real-time video visit. So that's the third type of real-time video visit. You may have heard some of these others as well. So when we talk about telehealth, there are those that it's the technology and they provide providers. And so Doc on Demand is an example of that, where they provide specialties such as urgent care, but they may also provide behavioral health specialists. And so there is that model out there. The goal for our types of providers would be for coverage, access to specialists that may not be involved in your practice, and managing even increased workload. So if you're just having such a large population of patients that you need assistance. The other type of telehealth program is a remote patient monitoring, and this is where patients are connected and providing data that are being monitored. And so that's the remote monitoring. It has to be monitored so that when something happens, an action is taken. And it can be an alert, and then there's a phone call from the clinician or a caregiver. There is going to be an action related to active monitoring of that patient. And then the last example is the async store and forward, and this is not a real time. The idea is that data is shared, so secure messaging, you may get a secure message from your patient and then you respond later. Symptom evaluation, you may have them fill out a form and some information and then send it later, or attach an image of a wound would be an example of that. When I joined NextGen a year ago, one of my first thoughts was I'd like to understand from our client perspective, because I just described telehealth, it's pretty broad, what are you interested in? So we did a voice of the client survey, and we received about 68 survey responses from practices totaling about 2,800 physicians. And you see the specialties that responded here. The majority was primary care, but there were some other specialties such as women's health, ophthalmology, and of course multi-specialty is a category which has multiple specialties in it as well. And what we heard from you is that 56% or more than half plan to use it or are using telehealth. So that told me that was something that was important for our client base. Of those who were not planning on using it or unsure, they mentioned that they prefer face-to-face appointments, or that they weren't even sure exactly what telehealth was. So that category had both those comments. The top 3 reasons and goals for telehealth: patient access, satisfaction, and practice efficiency. So being able to see more patients at a convenient time from an access standpoint. Of the client use cases and sort of preferred features, virtual visits for established patients was by far the highest volume. So providers wanted to see their own patients, so not necessarily a new patient coming in to see virtually. I have a relationship with my patient. I understand their condition, and so I want to see that particular patient virtually. And that's controlled, that's scheduled, so I wasn't surprised by that. The next category of live video visits of interest was the urgent care new conditions. And so that is still my same patient. I have a relationship with this patient, so I'm not opening the door to just anyone. I have a relationship, but it may be a new condition, it may be an urgent condition. So that patient wants to see me virtually, most likely. The async store and forward, remote monitoring, and the provider network services were a little bit lower on the popularity. However, async, being able to do the secure messaging and respond to the patient base, was the next type following real-time video. The features, mobile and desktop, having the insurance eligibility, patient payment aspect, patient intake, and triage built in were also some of the top features. I'm going to talk about telehealth reimbursement. My goal is just to talk about the trends. You definitely need to look at your own specific situation, and where you live and where you practice matters. So a lot of the legislation is by state, so it's very practice location specific, and it's also related to your own contracts with insurers and the type of services that you provide. So it is very, very custom to your particular scenario, but the good news is the trend is getting better. So I'm going to talk a little bit about private insurance, Medicaid and Medicare. My point of self-pay is that there are providers out there that are offering concierge services where they're asking their patient population to pay a flat fee for access to virtual, would be an example. So private insurance is getting better from a reimbursement, and not only just reimbursing the virtual visits, but reimbursing it at parity with an in-office visit. Almost 75% of the U.S. healthcare providers are covered by telehealth parity law in their state, and this is a picture of those states. More than 33 have some sort of telehealth legislation, with 33 having absolute parity. So that is a huge deal and great news for consumers and providers. For Medicaid, all Medicaid programs have some type of coverage for telemedicine. So this is showing the states that are graded higher with access to telehealth, and then there's 6 states that have made improvements to expand coverage. So again, the trend is going in the right way. 40 states allow home as the originating site for the patient, and that's a big deal because that's different than what Medicare was historically. Medicare, they would not allow it to be at home. And so the fact that Medicaid did allow home as the originating patient site is a big deal. And so jumping to Medicare, the traditional fee-for-service Medicare I was speaking about, beneficiaries are eligible for telehealth. They have been, but it was very specific limitations. So it had to be real-time video visits, which is one of the reasons why I think that may have been more popular with our client base. The originating site, they were specific locations of what would qualify as an originating site, and it did not include the patient's home. So a patient's going somewhere for a video visit, which doesn't really make sense. But the rural area requirement was a limit as well, and that makes sense, providing access to rural areas. There have been some expansions with the Chronic Care Act, the ACO telehealth expansion waiver, the virtual communication services. All of these are trending in the right direction, expanding telehealth coverage, and this was showing in 2020, but even this year, the 2 new types of virtual communication services that are being covered and having payment associated with them, the virtual patient check-in and the remote evaluation, are just showing that CMS is finally recognizing that even with the Medicare population, virtual care, virtual visits, telehealth is the right direction to move forward with. In the presentation that you will receive, we've listed some resources for you because of if you are interested in understanding your specific scenario of your state, to be able to look up the telehealth laws and reimbursement for your state, what CMS specific reimbursement rules are. The American Telemedicine Association is an industry group, and then you should always check in with your billing and service partners and check your own commercial contracts, because your specific scenario is important in understanding how to reimburse. So now I'm going to turn it over to Greg Toko. He will provide the NextGen office demonstration on how our technology can support virtual visits.
All right. Thank you, Cheryl. Hi, everybody. This is Greg Toko, Application Specialist for NextGen Office. So she kind of set the table real well as far as the background of telemedicine and how it's kind of moving forward. We're going to kind of discuss the product. Just a few things just to kind of set the table. You will need to have Premium Patient Portal in order to have the e-visit set up in your practice. If you have Premium Patient Portal and you have questions on it, you can please reach out to customer support. They can assist. If you do not have Premium Patient Portal, please reach out to your sales rep and they can kind of get that process started. So first and foremost, we're going to go ahead and schedule an appointment, show you how that looks from a workflow standpoint, and then I will initiate the e-visit on the EHR side, and then I'll transition it over to my coworker, Alex Karp, and he'll show you the patient experience. So coming in to schedule an appointment, we're on the practice management dashboard. We come into our day view, for example. Now, I already have one scheduled, but you'll see we have the e-visit right here. So you would just go ahead and select the time. You're going to want to make sure that you select your e-visit appointment type. That's important. From here, you put in your patient, any notes or reasons for the patient's appointment, and then you hit save. So that's how you schedule the appointment. Now, from a provider workflow standpoint, the provider would come over to the EHR side. From there, the provider would go ahead and select the time. So here's that e-visit appointment. If they select the time, this will go ahead and bring us into our encounter, and you'll see the telemedicine visit started. Hello. Now, what's nice about our telemedicine component is that it's actually built into the EHR. So while the patient is talking to the provider back and forth, you'll have full access to the SOAP note to kind of minimize any unnecessary back and forth. So from here, I'm going to transition it over to Alex, and he will go ahead and show you the patient experience.
All right. Well, thank you, Greg. So we should be seeing the patient portal login. Keep in mind, for clients who have this, you can actually embed our login page in your company website. So it's a very popular option. You can contact customer service if you're unsure how to do that. From the actual workflow perspective, so when I'm logged in as the patient, when we check in for the appointment that day, you can see the date and time that that appointment is booked. It allows that individual to answer whatever questionnaires you may need prior to the visit. So again, keep in mind this is a customizable field where you'll be able to put in your own questionnaires. When the patient completes this check-in process, they'll be given the side-by-side view of themselves with the provider. Hey, Greg. So what we can do here is there's also a chat feature. If the patient doesn't have access to a microphone, they can chat back and forth with the provider, and this is something that NextGen will store for you in the history log of that appointment. I'll go ahead and end the e-visit here. And so back on the dashboard, the last thing that we want to show you is the ability to request this from the patient perspective. So if I go into schedule an appointment and I select the option for e-visit, keep in mind, some clinics do not use a billable service to the insurance, so the actual CPT codes. They will have a flat fee associated to the patient directly. So that's what you have here. Some practices would have a flat fee. If not, it would take you into this next section where the patient is able to fill out that request form. So I'd like to be seen by the provider. Let's say I have some back pain. First available, but they can also put in their preferred days and times. And so when we send this request over, when we log into the practice management system, so I'm going to take back over the PM side, under your schedule, within the calendar page, you can see those pending requests, and your staff can modify them accordingly. So I can take this appointment and I can plug it into the appropriate visit type and update that request. So that'll end the portion of the telehealth webinar, and we'll open it up to Q&A.
Thank you, Greg and Alex. So I'm looking, so far I don't have any questions from the attendees. If you have any questions, go ahead and type them in the chat box and I will ask them and we'll get your answers. Still haven't heard any. Okay, so what I'm going to do is end this session. Thank you all so much for joining. Here's some information on if you would like more information on how to sign up for the Premium Patient Portal. If you are looking to get access to this telehealth feature, please contact your sales rep. If you already are a current client using the Premium Patient Portal and just have questions on how to use it, you can contact customer support. So thank you everyone for joining the call.